Hello. The topic of the video is Diagnosis of Prostate Cancer. Systemic Transperineal Prostate Biopsy. Content 1. Introduction of prostate. 2. Diagnosis of prostate cancer. 3. Systematic transperineal prostate biopsy. Introduction of the prostate. The prostate gland is one of the major organs of the male reproductive system. Its position is below the urinary bladder. Its secretion is mixed with sperm to become semen. Normal volume of the prostate gland is about the size of a chestnut and weighs about 20 grams. After 40-50 years of age, there will be different degrees of benign hyperplasia of the prostate, which affects the urinary function of many male patients. The prostate cancer is a common male cancer. The incidence rate increases over the past 2 decades. The prostate cancer can invade adjacent organs and may metastasize to other parts of the body, such as bones and lymph nodes, causing complications and even death. Early diagnosis and treatment can improve chance of recovery. The causes of the prostate cancer are not fully understood. May be related to multiple factors, such as age, race, positive family history, eating habits, obesity, smoking, and chemical hazard. The prostate cancer mainly grows in the peripheral area. The initial symptoms are not obvious. When prostate cancer causes obvious symptoms, the condition may be severe, or the cancer may begin to metastasize. Digital rectal examination and serum prostate-specific antigen (PSA) assist in the diagnosis of prostate cancer, which can be detected at an earlier stage. When the prostate cancer compresses the urethra, it will cause symptoms of urinary tract obstruction, including difficulty voiding, slow or intermittent urinary flow, frequent urination, urgency, increased nocturia, painful urination, hematuria, blood in the semen, or retention of urine. The above symptoms are similar to those of benign prostate enlargement, so the doctor's diagnosis is very important. The most common place for prostate cancer metastasis is the bones. When prostate cancer metastasizes to the bones, the lower back or spine may feel pain. It may also cause fractures and compress the spinal cord nerves, causing weakness or loss of sensation in the lower limbs, and may also cause acute retention of urine. Digital rectal examination can only check the peripheral area of the prostate, but most prostate cancer appears in this area. Prostate cancer may be hard, nodular, or asymmetric on digital rectal examination. Patient needs to consider prostate biopsy if abnormal digital rectal examination. Patient may be at risk of prostate cancer if elevated serum PSA. However, there are many reasons for elevated PSA, including benign prostatic hyperplasia, urinary tract inflammation, acute urinary infection, or patient who have retention of urine. Prostate cancer cannot be diagnosed solely based on elevated serum PSA. Elevated serum PSA should be considered as an indication for patient who needs further tests to determine whether he has prostate cancer. Patient needs to consider prostate biopsy if elevated serum PSA with suspicious of having prostate cancer. Magnetic resonance imaging, with the use of contrast agent and new scanning technology, the chance and severity of prostate cancer can be predicted more accurately. In patient who has completed the imaging, prostate biopsy can be performed under the guidance of magnetic resonance imaging ultrasound fusion technology, which will help more accurate and targeted biopsy of the suspicious area, improving the accuracy of the diagnosis. But magnetic resonance imaging still cannot replace biopsy to confirm prostate cancer. Transrectal ultrasound of the prostate is not diagnostic of the prostate cancer, mainly for assisting the prostate biopsy. Prostate biopsy is diagnostic of the prostate cancer. The examination needs to be performed using the ultrasound. Prostate biopsy is taken through the rectum or perineum using a biopsy needle. If prostate biopsy finds cancer cells, doctor will suggest ways to treat the prostate cancer. Studies have shown that the transperineal prostate biopsy is safer than the transrectal prostate biopsy. Systemic transperineal prostate biopsy. The whole procedure takes about 10 to 15 minutes. By placing an ultrasound probe in the rectum, the doctor systematically takes the prostate biopsy through the perineum for histological examination. If the patient is taking drugs that affect blood coagulation, please tell the doctor before the biopsy. These drugs may need to be stopped before biopsy. If the patient has symptoms of urinary tract infection before the biopsy, such as fever or painful urination, he should also report the symptoms to the doctor. Possible complications of transperineal prostate biopsy include life-threatening sepsis, urinary tract infection, anal bleeding, hematuria, blood in semen, difficulty in urination, urinary retention, slight perineum swelling, and short-term erectile dysfunction. After the prostate biopsy, patient can be discharged and arranged follow-up date if the condition is stable. It is advisable to drink more water for a few days after the biopsy if possible. If bleeding is severe, fever, or persistent symptoms, please consult the doctor. Here's the end of the video presentation. Thanks for watching.